Good morning, everyone. To all the extraordinary, fearless, smart, and caring mothers out there, nobody holds up the world the way that you do. Happy Mother's Day to all the mothers out there. It's definitely not always the easiest job, but indeed, it is the most rewarding one. On behalf of Villamari Degree College, I wish a very happy Mother's Day to all the mothers out there. I am Mrs. Revati Devi Mathur, in charge Villamari Degree College. On behalf of Villamari Degree College for Women, I welcome you all to the national webinar. Villamari College has carved a niche for over 25 years now and has always been the nexus, emphasizing the entire academic and extracurricular activities. We at Villamari not only believe in transferring knowledge and teach important skills, but also to raise fundamental questions. We create dynamic learning environment for all our students by using best practice teaching methods that will foster the continuous learning and growth of every student. This has thrown Villamari on the meritorious list for being the most consistent, high performing college in the Twin Cities. We aim to nurture all students so that they become successful, confident, creative, active, informed citizens who are able to contribute to the society. This contrast of modern technology and traditional education is made possible by our pioneer, our founder, director, Dr. Philomena Ma'am, who has been a trailblazer in the field of education with her brainchild, Vilamari. Dr. Philomena Ma'am's untiring service to this institution is indeed remarkable because she has the ability to bring about a change and thereby make a difference in the lives of her students. Today, we are delighted and honored to host the national webinar on COVID-19 Survive and Thrive, Reset and Revive Life Skills, hosted by the IQAC team of Villamari Degree College for Women. I thank you all for taking time out and being here today. We are pleased that as much as 250 delegates are in attendance in the webinar today, being from different states and countries, namely Dubai, Maldives, Tamil Nadu, Kerala, Karnataka, Gujarat, Madhya Pradesh, Pondicherry, Chhattisgarh, Andhra Pradesh, Haryana, and Maharashtra. I welcome you all to our national webinar. I realize that you are fully dedicated to the sessions that will follow. The webinar is principally designed to keep ourselves abreast with the present scenario and safety precautions post-lockdown, as we are responsible for the intellectual development of our nation. I hope this webinar will highlight on valuable inputs which can positively impact the faculty-student connection. I wish you a very fruitful and a productive meeting. Thank you. I now request Mrs. Atiya Nusrat, IQAC Coordinator, Villamari Degree College, to take over the proceedings of the webinar. Over to our IQAC Coordinator, Mrs. Atiya. Thank you.
Thank you, ma'am. Good morning, everyone. COVID-19 is not just a virus which is making people sick. It has become the catalyst which is changing everything around us. Things are certainly changing at this time of uncertainty, and it is crucial that we act upon during these times and make ourselves ready for the new norm. Through the lens of medical experts today, we shall have a detailed insight on what is to come and how to gear up to survive and thrive. We are indeed ensconced at home now, but when we unlock ourselves, we should ensure safety of our student community from the jeopardy of COVID-19 and continue to deliver quality education despite many challenges. Today, we collaborate with two eminent clinicians of medical fraternity to contemplate on the present scenario and aftermath of lockdown. On behalf of the IQAC team, join with me in giving a convivial welcome to our doctor with a sharpened pedagogical skills, Best Teaching Faculty, Best Eminent Teacher Award in Microbiology. He is Dr. Anil Bilolikar. A practiced microbiologist in Iran for many years, he is now the consultant microbiologist in Krishna Institute of Medical Sciences. He served as an assistant professor in NIMS Hospital and Osmania Medical College, respectively. He has to his credit almost 25 national and international publications. Hearty welcome, Dr. Anil.
Thank
Moving
you.
on to extend a cordial welcome to a renowned ophthalmologist of Twin Cities, Dr. Manoj Chandra Mathur. He is a senior consultant at Swaroop Eye Center and Medivision, Hyderabad. He was also a managing member of the All India Ophthalmological Society and is at present the advisor and past president of Telangana Ophthalmological Society and Hyderabad Ophthalmologist Association. Dr. Manoj Mathur has to his accolades several awards and honors besides scientific paper presentations at the national level. The Best Scientific Poster Award of Telangana is currently conferred on his name. A delightful welcome, Mr. Manoj Mathur. I request Dr. Anil to take over the proceedings. But before we begin the session, a gentle reminder to all the attendees that your queries and doubts will be addressed after the session ends. Please drop your suggestions in the chat box provided. Also, for the smooth session, please ensure that you are on the mute mode. Over to you, Dr. Anil.
Thank you. Good morning. I would like to thank Vilamari Degree College Management, Revati Mathur in charge, Mrs. Atia Nusrat, Saida, Computer Specialist, Quality Department, and all the administrators for giving me this opportunity to speak on novel coronavirus disease, present scenario, and safety profile. Uh, Good morning to all respected degree college lecturers. So I would like to tell you about the facts that we need to understand about this virus and about the pandemics and staying safe and propagating the same knowledge to our students so that they stay safe and the community stays safe. Pandemic, and even before Christ, there were few pandemics. The one that was noted was in 430 BC, and it was due to bacteria. And after that, several pandemics had come either because of smallpox or plague or cholera or the Spanish flu. And then during all these mankind's, I mean, half of the mankind had disappeared from the earth. Presently, now we are facing the situation of coronavirus. So in the month of December, the first case was detected in Wuhan province of coronavirus. It was thought to be a viral pneumonia. And slowly by December 31st, these viral pneumonia cases started increasing. And at this point of time, China had alerted WHO of several pneumonia cases. And by January 1st, am I audible? The Wuhan wet seafood market was shut down. And this virus was first isolated on January 7th, and it was named as COVID-19 virus. And the first death due to COVID-19 was reported on January 11th. And slowly this disease started spreading outside China, that it came to Thailand on January 13th. And by January 23rd, the Wuhan city was placed in quarantine and all the rail and air services were suspended. So if you see, during 6 weeks, the disease has progressed so much that one city had to be locked down and the disease had spread outside the country. And then after that, you know what is happening. Now coming to the Indian scenario, in India, the first patient was reported on 26 February and these were 3 patients who has a travel history of coming from China. They are the medical students who had come from China and they have presented with this disease in Kerala. And here I would like to tell something about the outbreaks which have earlier happened, and some of these outbreaks were of epidemic proportion, and more so some of these members, they belong to coronavirus family. If you look at this Marburg and then SARS, these are the members of the same family as coronavirus. And if you have observed on the screen, there are several animals are seen. So these animals, these viruses are actually infecting these animals. But after some mutations, these viruses are capable of infecting a man, and from man to man there is a transmission and causing so much infection in all over the world and deaths and fatality. And if we see here, uh, previously this SARS and MERS, the fatality rate is high. That is, in SARS, the fatality rate, if you look at the SARS figure, it originated with a bat and transferred to by mutation, the infection was transmitted to the civet, that is a type of a cat. And from cats, this infection has transmitted to humans. And if you see, the fatality rate is 10% in them. Now, in 2012, MERS outbreak was there. It happened in Saudi Arabia. From bats, this infection was transmitted to the camels, and from camels to the humans. And the fatality was 34%. See, even though the fatality was high in them, but the transmission was less. That means they were able to infect less number of individuals. So this is one difference what we are facing with coronavirus. Here this virus has got a high rate of transmission but a lower rate of mortality. And the official name COVID-19, that is coronavirus infectious disease 19, was given by WHO, and this virus, it is called as SARS-CoV-2, that is severe acute respiratory illness caused by coronavirus 2 by international community of taxonomy of viruses. And on 11th March, WHO has declared it as a pandemic. Pandemic is a disease like it is an epidemic which crosses the international borders and affects many thousands in various continents. So that is a pandemic. Epidemics are limited to few countries, but pandemic is crossing the international borders. Now, first, I would like to give some brief introduction about any virus. So this virus is a submicroscopic infectious agent that replicate inside a living cell. So this living cell could be either an animal or a human. So what happens is this virus, once it gains entry into a host cell, that is either an animal or a human, the host genome, if you look at this figure, the genome of the after the virus gains entry, the genome of the virus gets integrated with the host genome, and then now this genome, it starts multiplying, but not as a human cell, but it functions as a viral genome, and then it multiplies into thousands of genomic particles, and each one has a capacity to form one individual virus, and then they start infecting the neighboring cells and other tissues and then organs, and then one person gets in, becomes symptoms of any viral infection. With this knowledge, we'll go on to coronaviruses. So coronaviruses, these are large enveloped viruses, and they are spherical in shape, and their size is 120 to 160 nanometers in size. So they are one of the largest viruses, and these viruses have the capability of infecting humans and animals, especially the camels, bats. These are their reservoirs. And there are 4 genera in this. One is alpha, beta, gamma, and delta. Why I am telling you all these basics is because these are all the viruses. They pose a challenge in vaccine productions and transmission. There will be a continuous spread of these kind of viral infections in our epidemiology. Now in 2002, we have already seen that SARS had come, and then after that 2012 Middle East respiratory syndrome, that is MERS, had outbreak was there. But now presently in 2019, now the outbreak is SARS-CoV-2, that is SARS coronavirus 2, and then it is a reservoir is present in the bats, and from that it is transmitted to the pangolins. Pangolins are some kind of mammals, and these are utilized as some form of exotic food or for medicinal preparation in China. And then this virus got mutated in pangolin and started infecting humans. And there's a transmission from humans to humans. Now, if you look at this structure, this is a structure of a virus, which is an electron microscopic picture view. Now, so what I would like to emphasize here is it is a circular in shape, and there is an outside layer which shows some kind of spikes are there. So these spikes, they act as some, they are the attacking agents to any human epithelial cells. And these are called as glycoprotein spikes. So these have the property of stimulating our immune system to produce antibodies. And after that, there is an envelope layer is there, and then inside we have that blue color structured is all RNA. So this is an RNA virus, which is a single stranded RNA virus. And all these structures are important to know because in development of immunity and for diagnosis purpose and in disease presentation. Now, if we look at what infection does it cause, it causes a picture something like a routinely what we suffer is like a common cold, and after that there is a lower respiratory tract infection, and more so about the sore throat, and then gastroenteritis, and that is mainly seen in infants. And these patients present with fever, fatigue, there is a dry cough, and they have breathing difficulties. Now let us understand what is incubation period. The incubation period of COVID-19 is thought to be 14 days. That is, it could be anywhere between 7 days up to 14 days. So during this time, the virus gains entry into any healthy individual, then it multiplies, and then now they are in sufficient numbers, in large numbers, and then the disease presentation starts with symptoms like the patient develops fever, malaise, cough, and breathlessness. Now, what does the patient suffer from? Like, what are his complaints? His or her complaints are: the patient presents fever, there is a cough, there is a chest pain, breathlessness, sore throat. And this sore throat is not that typical, not what we normally suffer from bacterial infection. It could be a severe type of sore throat, so which is some kind of alarming signal. And then there could be a diarrhea, nausea, and severe body ache. If you look at these are the various presentations of the patients, like a high temperature, fever, tiredness, dry cough, sore throat, and there is nasal congestion and running nose, and sputum production, and then there is a headache, difficulty in breathing, and diarrhea. Now with this, so these could be all normal presentation of this disease. But now how should we come to a diagnosis of COVID-19 infection? So for that, there are few definitions are there which we need to understand. See, one, now here we have two types of groups basically. One is a patient who's presenting, who's having a high fever and presenting a disease. And the second one is a healthy individual. So who gets into contact with this patient? And lastly, there is one third category. Once a patient is diagnosed with a confirmed report, is a laboratory confirmed case. So we'll see one by one what they are. Now a suspected case. Who's a suspect? A patient with acute respiratory illness. That means patient is having fever and with signs and symptoms such as cough, shortness of breath, and travel history. Now travel history is like international travel was considered earlier, but now we can consider a travel history like visiting some place, like either some gathering or a temple, or visiting a bus stand or a railway station. These are all coming like high risk areas now. And in a hospital setup, a patient or a healthcare worker who has this illness has been in contact with a confirmed COVID-19 patient in the last 14 days. Supposing if one patient is diagnosed after some time COVID-19 and we had treated him, so we all are suspect patient. And now this is one patient who's having severe acute respiratory infection and needs hospitalization. Now this is what is mostly the community is facing. There are elderly individuals, especially males, who are having high fever, respiratory symptoms, and they are breathless and they need hospitalization. So these are strong suspects. And then now lastly, a patient in whom COVID testing was done and maybe first report came negative. So there is a possibility that this patient is also a suspect case. Now this is straightforward, a laboratory confirmed case. That means this is a patient who had severe illness and then the sample was sent to the laboratory and the test result came positive. Now this patient needs quarantine and proper treatment. Now coming to the contact. Here I request you to pay some attention because contacts are the ones who are at risk of developing infection, and these are the people who can spread to others in the community. So a contact is a person who is involved in treating a patient without a proper personal protective equipment. This is in a hospital setup. When we attend to any patient without proper apron, mask and gloves, then we are a contact. Or staying in the same close environment as COVID-19 patient. That is in a workplace, classroom, or a household, or any gathering. See, if from a workplace, if somebody is diagnosed as COVID-19, but if you happen to interact with that person 3 to 4 days back from the same classroom or the workplace, so we come under contact. Or traveling together in close proximity, traveling in bus or a train and sitting in 1 meter distance. So this, and later on that person tests to be positive for COVID-19. And then contacts are of two types: high risk contact and low risk contact. So high risk contact are the individuals who have come into contact with the patient's body fluids, that is the respiratory secretions, that is the endotracheal secretions or sputum in the lab that can happen, or blood, vomit, or saliva, or urine, or anything, or had a direct physical contact with the body patient and doing a physical examination without proper PPE. So if we do any kind of examination, the physical examination to the patient without proper PPE, the risk is high. And this, the third point is very important: touched or cleaned the linen, clothes, or dishwashing. See, now what happens? There is a possibility in any house individual and any situation this can happen, or lives in the same household as the patient, or anyone in the close proximity of 3 feet for 15 minutes with a confirmed case without precautions. So all these possibilities are there. If we are sitting in within 3 feet for 15 minutes and later on that person turns out to be positive, and if we are not wearing mask or if we have not done hand washing properly, there is a high risk. And the low risk is sharing the same classroom or the school or the workplace wherein one person was found to be confirmed COVID-19, or travel together in the same environment, but there is no risk of high risk exposure. Now these were the individuals who spread the infection, but now how does the infection spread from one individual to another individual? And that is mainly because of the droplets. See, if you look at this picture, if one individual coughs, see how many droplets are falling. So now the droplets, so these are the, see, when we cough or a sneeze, you might have observed that many droplets, the shower which comes out has got droplets in them, and in that there is a viable virus or bacteria is present. Viable means life, so which has a capacity to infect others. And when these droplets, they can seed on the mouth, nose, or face, and who are within 1 meter. So that is why what we are telling, maintain social distance of 1 meter. It is for this reason. So never come in close contact with each other. Maintain 1 meter distance. And then what happens is when these droplets, when an individual has coughed while working on a table, so there's every possibility that this droplet can fall and settle on the table and some kind of objects, either your laptop or your mouse or the pen or any of these things, and they settle on them. And unknowingly, if the next person comes there and touches it, and then touches the face, nose, mouth, and then he gets infected. So the main mode of transmission is through droplet, and then the next is like the contact transmission through inanimate objects. So that is why we need a protocol for surface disinfection on a regular basis. Now look at this. when an individual has coughed, 10,000 droplets have fallen down, and these droplets have a capacity to survive up to 3 days, sometimes on steel and plastic, based on the temperature and the humidity. Now, if you look at it, how long these viruses survive? It is 1 to 2 days on the non-porous surfaces and 8 to 12 hours on porous surfaces. And a low temperature and high humidity, it favors the survival of these organisms. Now, here this is a very practical, important point we all of us should understand. How can we destroy this virus or inactivate the virus? The first and simple method is by heating. That is, when you heat at 50 to 60 degrees centigrade, the virus will get destroyed or it will get killed. So by boiling or by proper cooking, when the temperature is 100 degrees and above, this virus gets killed. Now, the use of detergents. Here, detergents, I mean, in our setup, either a soap that can be practically used at home. Any good quality of soap can destroy this virus. Coronavirus is an enveloped virus. So this envelope gives the protection to the RNA. So when we use a detergent or a soap, this will inactivate the outer envelope layer. So then what will happen is the RNA gets exposed to the nature or to that soap, and then the virus gets killed. So that is why soap solutions can kill this virus. And then UV rays can kill this virus, but this is not one method of sterilization in a domestic purpose or in a classroom, but this is, we do it in our laboratories to inactivate the viruses in the instruments. Now, if you look at this picture, now what are the various organs which are affected? See, this coronavirus, it can infect mostly lungs, kidneys, and intestines, because these organs have got ACE2. So what it is, it helps in binding the attachment of the virus to the human tissue. Now, so that we will see in the next slides. Now the patient presents with headache, cough or sore throat, and breathing difficulties, which will lead to the complications such as pneumonia, acute respiratory distress, and kidney failure. Now, who are at risk? Who are at more risk of developing infection? See, we all of us, once we get exposed to this virus, we all can get infected, but the risk is high. That means the outcome in these patients is bad or catastrophic. So what are those medical illnesses in which we need to protect such individuals? That is COPD, that is a chronic obstructive pulmonary disease, which is seen in elderly men who are smokers. So in them, this disease, and then heart disease, hypertension or chronic renal disease, and diabetes, and some kind of malignancies. So all these patients, they are on some kind of treatment and their immunity is low, and then they are vulnerable for this infection. And in them, the chances of early recovery are not as good as compared to a healthy individual. Now, if we look at this cycle in which there's a bat coronavirus which has infected the bat coronavirus and the pangolins, they are in contact with each other in the environment epidemiologically. And when these pangolins are used as a food or for medicinal purpose, comes into contact with humans, and then there's a transmission from humans to the humans. Now, here I would like to explain how this coronavirus, it will infect humans. Now, the mechanism is, if you look at this, earlier we have seen that virus. Now if you, now this, the whole sequence we are showing here. Here, there on the virus of the corona, there are some spikes are present, petal-like structures. So those, they will bind to the host cell. The host cell, yellow color demarcation, and we are showing one cell membrane. So on that, there is one receptor is present, and that is ACE2. So this calyx, I mean this spike of the virus has an attachment, has an affinity to binding this virus. And once it binds it, it's a permanent lock-like structure will happen, and then the virus gets engulfed within the cell. And further, it is facilitated by this. There's a knob-like virus, I mean violet color structure is there. So that will facilitate its binding. And here, if you see, there is one inverted T-like structure is there. So that is a protease inhibitor. So if protease inhibitors are viral antivirals which are given, so they will prevent this binding. So here I would like to mention why earlier SARS coronavirus infection was less. I mean, they could not attain this pandemic proportion, whereas SARS-CoV-2 has the capacity of forming the pandemic proportion. It is because SARS coronavirus has a capacity of 10 times more attachment to these kind of ACE2 receptors. So once they come in contact, the binding is complete and perfect. So the transmissibility is high for this virus. Now, once the infection has developed, now what are the chances of recovery, let us say? So this is a study based in China. So what is observed is, if you look at it, 80%, around 80 to 81%, they are mild cases. That means their recovery is fast. That means after 14 days, till 14 days, the disease is maximum. And after that 14 days, after 28 days, 80% of the individuals are going to recover. Now, there is an issue with 14% of individuals who present with severe cases. And these are the individuals who have that underlying causes, risk factors. And there is a 5% of the patients who land up in critical cases. Critical cases are the ones, mostly these are the severe cases, or sometimes now these mild cases, young individuals, if they ignore the early symptoms and then they take medical treatment late, and then they can also fall into the category of critical cases. So it is better to approach a doctor or the treatment centers early whenever there are mild symptoms are there. So it is possible to treat this disease. But if a healthy individual takes it not very seriously, ignores the symptoms, and then there's every chance that young individual can have outcome is bad. Now, with that brief knowledge of how the virus attaches to the human cell and what is the outcome of this disease. Now, let us look at these pictures. That is the inflammatory response to this virus infection. Now, if you look at it, there are two demarcation, I mean, two arrows are there. So one major group on the right side is, these are the host or the individuals, they have survived. They have survived because of they have developed. See, both the groups got infected, but the outcome in this group, post survival, is that this individual has overcome that viral infection developed protective immunity and he is surviving. Now this one second group. So what is happening in this healthy individual? I would like to spend few minutes on this slide so that you will have clear idea what happens here. Now a person who survives, the immunity is good. That means the inflammation is there, but the viruses are not replicating in large numbers. And as the virus replicates, there is an early inflammatory interferon response. See, naturally our body will produce interferons to any viral infection. So in these individuals, the interferon response is early. So that will lead to all protective processes. And the inflammation is milder in this. And then what will happen is the cells, endothelial cells and epithelial cell destruction is minimal. There is a reduced vascular leakage. And there are T cells and B cells. T cells will give us cell-mediated immunity and B cells will give us antibody immunity. So both these processes are stimulated, and because of which antibodies are produced, and then they are able to clear the virus and this individual is protected. Now coming to the other group, wherein the viruses are multiplying disproportionately. So, and here what has happened is the inflammatory interferon response is very delayed. Viruses are multiplying and there is no interferon response is there. Then there is a marked inflammatory response. That is monocyte, macrophages, neutrophils. They start producing lot of cytokines and chemokines, and then they land up in a syndrome called as CRS. So all this will lead to the, now each cell we are talking about. Now the epithelial cells and the endothelial cells, they will get destroyed, and there is a vascular leakage, and the T cell and the B cells, they are not stimulated to produce protective mechanisms. And as a result of which the virus is still persisting in that patient's body and they are still multiplying, and all these chemical markers are multiplying, and because as a result of all these complex processes the lung gets damaged and it is called as an acute lung injury, and then because of which the patient lands up with acute respiratory distress syndrome and he becomes breathless and he needs immediate hospitalization. And when this patient is not put on ventilators and proper treatment is not given, and then this patient can die. After that, now let us move on to the laboratory diagnosis of COVID-19. Here I'll tell you the very basic and very important points which we need to understand and remember. The gold standard test for detection of COVID-19 is RT-PCR. First, so this test is done in laboratory and of India nominated many laboratories to perform this test. So what is the EG? So there are two tests are performed in this. One is a first line screening assay in which E gene is detected and the confirmatory test is done, and in which there are many genes are detected, that is open reading frame 1B, RD, RDP gene and E gene and N gene. So this confirms that in the first screening assay we will know it is a coronavirus, whereas in a confirmatory assay we will know that it is coronavirus 2, COVID 2, that is COVID-19. So not some other coronaviruses. So these are the various processes which I have shown. How the test is done in the laboratory. Patient sample is taken. From that patient sample, RNA is extracted. If you are seeing some blue colored test tube is there in that, we have isolated the patient sample from that RNA. And then we put it, and we put many reagents in that. And then after that, RNA is isolated. And by one process called as reverse transcriptase, from RNA, DNA is developed, and then that DNA is amplified, and then it is scanned on the screen, and then we'll visualize the viral pattern, and we'll look at all the genes, and then the test result is issued. So this is a very complex process, needs trained technicians and that kind of facility, because there are millions of viruses are present in this. So the people who are processing, they are at very great risk of developing this infection. Now there are other tests are there, that is detection of the antibodies, anti-SARS-CoV-2 antibodies. These are also important in knowing the epidemiological surveillance, like in a society or in a country, how many got infected. So this we will know through these kind of tests, and we can also know when a person has suffered from infection, developed anti-protective antibodies, and these antibodies are detected by these tests. So we can also know immune status of these patients. And these tests, they become positive after 7 days or 14 days. And there are some tests which are under trial. Antigen detection test, strip test. Because all of you should know this, because this is the future. Because we want simple tests that can be performed in small setups also, where proper protective equipment are there. By taking salivary sample, we should be able to detect this antigen, and this can be used for mass testing. But as of now, we cannot know what is real sensitivity of this test, and whether the RNA, what we are detecting in this test, is it has got its own limitation. So the quantity of RNA, how much is required, we cannot really determine on this. Now this is just summarizing. Now this is a individual. There are two columns are there in that. First, we are able to detect the, we have shown one individual and one healthcare worker is collecting a swab. It is a nasal swab or a throat swab, and then that is sent in a viral transport medium, VTM, and then it is sent to the laboratory, wherein the DNA is RNA is extracted, DNA studies are done, and we know the test report. And these tests are called as a molecular test, polymerase chain reaction. And the next is that the serological test, in which we detect the antibodies. And this is used for epidemiological purposes. And I think if you have observed at the bottom, below the girl, there is one group is there. That means out of one group, it is possible for us to identify one person got infected, and that is the need of the present situation. Now, if you want to, and if you look at the right thing, right, there's a big group, some are in white and some are in orange. So this is like a mass, whether they got developed herd immunity, and then how many of them got protected by infection, subclinical infection. So for that, we need antibody detection test. Just this is one important finding I thought I'll share with you. This is a CT image in which, if you see, this is taken at the level of the chest, and if you see in that there's a dark black area is seen, in that there are some circular shadows are there, and that is called as a ground glass opacity. See, if any hospital has no facility of testing for molecular testing of RT-PCR, then we can do this test by which we can rule out whether the person is suffering from COVID-19 or not. So this is just the summarization of what an individual got infected and the various, what is the diagnostic modalities, the staging and the epidemiological surveillance and the recovery or the death. Here I would like to first explain you something about three terms, that is window period, IgM antibodies and IgG antibodies. I'll show you the next graph. If you see this graph, the blue line, if you look at this figure, that blue line, blue curve, which is rising over a period of time and then decreasing, is the viral RNA. And then the green is IgM antibody appearing at 7 days and disappearing at 21 days. These are short-lived antibodies. And then the IgG antibodies, they are appearing at 14th day and they are rising and they are present for a longer period, maybe up to 2 to 3 years. So I'll go back. Now the window period is the period in which the virus has entered the host, it had started multiplying, and the patient has no complaints, no symptoms. They are moving, they are coming to the hospital as one of our doctors or a nursing staff or a technical staff, or they could be your students or anyone. So they are still in the window period because symptoms have not appeared. They do not have fever, they do not have cough or running nose or headache or malaise or body ache, any of these things. Then the next important thing is, what are IgM antibodies? IgM antibodies are protective and they develop in acute infection and they are present for a limited period and immediately they are capable of neutralizing this virus and eliminating from our body. Now the IgG antibodies, they appear late, but they stay for a longer time. And then that indicates that this infection, whenever there is an IgG antibody, it indicates past infection. And whenever there is an IgM antibody, it indicates present infection. Now, see, based on this, how much significance can we give? See, now these are some of the that we have discussed earlier, and we are showing them the positivity rate. If we do an RT-PCR by which we are detecting RNA, so in 67% of individuals, we can diagnose in 1 to 7 days, whereas it is decreasing to 54% and 45%. If you see this blue line, so that means patients who come late, in them the positivity rate of this test may be less. And development of antibodies, if you see in the first week, the antibody testing is of not much use, it is less than 30%. And then whereas in second week and third week and fourth week and like that, the antibody tests are of more use. Their positivity rate is high. If you look at these figures, they are more in the second week, third week and fourth week and beyond. Now based on this, the treatment. Now the treatment options, like any other viral infection, generally the laymen, what they do is across they do not visit a doctor, and on their own they go to a pharmacist and across the counter they collect some antibiotic and start using it. So this should be avoided. As a rule, no antibiotic works against the bacteria. And then there are many therapies are present, like Western therapy, traditional and home remedies. See, all these, they work well, but there are no definitely documented studies are there. So when the symptoms are present, it is always better to approach a doctor or a treating center. Now, if we look at this figure, so here this is how the presently that these patients are being treated. They are treated with the anti-malarial drugs or antiviral drugs, that is interferon. Anti-malarial drugs is chloroquine or hydroxychloroquine, and then the antiviral drug that is specific for this virus is remdesivir, and then the anti-HIV drugs, human immunodeficiency virus, lopinavir and ritonavir are also being given to these patients. So all these treatments have worked out well, and based on the understanding of the disease process, the pathology, the treatment may also vary in future. So presently, anti-malarial, antiviral, that is interferon, and specific drug antiviral, that is remdesivir, is the current way of management of these patients. Now let us talk about the vaccines, because now till for any disease, because there are many diseases which are prevented with a vaccine. So this is a need of the hour. Presently, everybody is talking about vaccine. When is the vaccine available? So as of now, there is no vaccine available in the market, and around 120 vaccine projects are going on all over the world, and they are in the phase 1 to 3. See, whenever a vaccine is produced, it has to be checked in the laboratory animals first. That means whether it is immunogenic. That means in the laboratory animal, whether the same disease is being presented. Then, and the animal should be able to produce antibodies to that vaccine is important. So after that, then it should be safe also. If there are more animals are dying because of it, then means this is not safe for animals. Then this project cannot be proceed further. So once it has to be made sure that it is safe and it is antigenic, then it goes on to the second phase, then the third phase, and then the fourth phase. In the second phase, the humans are in trial. So all these works are going on, and it will take some time. It may take, so we have to adopt to the preventive measures till we get safe, effective vaccine in the market. So we do not know presently how much time is required for that. So there are 7 human trials are going on, and in India, the Serum Institute of India is a partner. It is the largest vaccine manufacturer in India, and it is a partner in one of these trials. And we have to wait for some time to know the results. These are some of the few important vaccine trials which are going on. See, here I would like to focus on the technology. See, that is important. Now, if you look at the first one, it is recombinant adenovirus 5 vector is taken. So what is done is adenoviruses are taken, in them these are tested, and then they are taken as vector, and these viruses should multiply in them, and then we get a maximum yield, and then injected into humans and tried. And then now this is a promising one, CHADOX1 in COVID-19, in which adenovirus vector is taken, and this is also in phase trial 1 and 2. And we have 2 more other trials going on. So time alone will tell how much they are effective. Now lastly, with this knowledge, till an effective vaccine is available, it is responsibility of all individuals to protect their own self and protect their neighbors, loved ones, and everyone. The first one is the hand washing. See, we all of us know that hand washing we can destroy the all the bacteria or viruses, but this is a misnomer. Actually, I do not have a slide in which it shows after hand washing. Normally, that is done, and if we see under UV rays, there are thousands of bacteria and viruses are present because that is not a proper hand wash. So the time that should be given is 20 seconds. See you next time. You note the time, how much time you are utilizing, and do it for 20 seconds. How it has to be done, I will tell in the next slide. Avoid touching your eyes, nose, mouth, and practice respiratory hygiene by coughing or sneezing in a bent elbow or a tissue, and that tissue need to be disposed immediately, and wearing a mask 2-ply or 3-ply, and maintaining a hand hygiene and maintain a social distance of 1 meter. Now, if you look at it, these are the steps of hand washing. You have a good quality of soap or you have an alcohol rub. Do it for 20 seconds. Take it in a palm, that soap, and then you rub palm to palm, and then between the fingers, and take the right hand on the left dorsum, on the left hand, and rub it. Same way, left hand on the right hand, and then take a thumb, then the thumb, left thumb, and then the right thumb, and then clasp both the hands and back of the fingers. See, all these movements are repetitive, both right side and left side. And now the notorious area is your fingernails. So in your left palm, the soap is there, and your right palm fingers, they should be rotated like this. And same way with the left fingernails on the right hand. And then the left wrist, and then the right wrist. And then rinse and wipe your hands. Now your hands are safe. They do not have any microorganisms. So please follow this. This is the biggest, safest vaccine as of now. Now the next important thing is, I'll quickly summarize through it. Prevention. Practice social distancing. Avoid any non-essential travel. Only when it is necessary, go out of the house, and do not make any unnecessary travel, because we don't know, in the crowd there could be one person who could be an asymptomatic carrier. And the gathering should be limited, and washing the hands using a tissue, and avoid touching your face, eyes, and nose. And see here, actually same repetition is there, but I would like to show that taking steam inhalation, these are all the preventive things you can read, I think. So there is a steam inhalation that also works good. So if it is possible, every day night you can do salt water gargling and steam inhalation. So at present we are facing a situation of a lockdown, and this is done with an intention to break the chain of the spread of transmission of this virus. And Prime Minister Modi has told us, has requested all of us to stay safe, stay home, and help in breaking the what I should say, the chain of the spread of transmission. So in which our government is doing lot of things, and there's lot of responsibility of, we are all are responsible citizens and teachers to spread the same message to our community and to students and to all. And these are all the coronavirus warriors in their capacity. Each one of us is trying to help our community and save us from the infection and save from transmission of infection. I thank you all. Thank you very much.
Thank you, Anil. That was a wonderful exposition about the COVID virus. And now it is my turn to share my views about the post-lockdown phase. What are the precautions that we need to take? So, hearty welcome to all the delegates. I am Dr. Manoj Chandra Mathur. I shall be talking about the precautions to be taken post-lockdown, an exposition under the aegis of Villa Murray Degree College for Women, Hyderabad. So, the scope of my exposition today will be to discuss about the infectivity profile of the pandemic, India's performance in controlling this pandemic, as to how we are doing as of now, the current status and the future projections, were the symptoms and case definitions, what was beautifully enumerated by Dr. Anil. I shall be again reiterating those factors. Plus, I shall be concentrating upon personal hygiene and personal protection. That also has been covered by Dr. Anil, but I'll be reiterating those factors. Then my most important thing is the UGC has come up with certain guidelines to the universities and how these guidelines are going to impact all of you academicians in the post-lockdown phase. I shall be trying to give a comparison as to how in the hospitals we are trying to tackle with these situations and how ideally we expect the academicians to follow, though what I am speaking today may be the ideal, but you have to devise your own strategies in the most practical way. And that shall be at the end presenting to you as a regimen from clinicians to the academicians. So, if you see this graph here, if we had not taken any measures to control this pandemic, suppose at this point is the outbreak, the disease would have progressed, the number of cases would have risen in this way, in this bell curve, and that would mean that we are exposing 130 crores of our population to the disease, and with the current 3.12 mortality that we are observing, we would have lost 4.5 crores of our population. We would have ended up losing with a figure of 4.5 crore fatalities. So what is required to be done in case of pandemic is what our government tried to achieve first initially by the imposition of Janta curfew. They wanted to sensitize the population to this factor, followed by the lockdown. And what do we intend to achieve by following this lockdown? We want this curve to remain below the capacity of the healthcare system that is shown by this line. What would happen if the number of cases rise and go beyond the capacity of healthcare system? Even the healthcare workers and the doctors get infected, the healthcare system curve falls down and there would be chaos. So this is exactly what we need to do to control the pandemics. India's performance in controlling the pandemic, you should know an important statistic is the number of days for coronavirus cases to rise from 100 to 1,000. Our lockdown measures went a long way to contain the spread, and India stands in the second position. It took us 15 days to reach from 100 cases to 1,000. And Japan had the distinction of leading this effort. Probably their way of life using masks on a regular basis, they were able to achieve this rate of 29 days for the cases to rise from 100 to 1,000. We did reasonably well with 15 days. The initial countries where the virus was detected, they reached this phase in just 5 to 6 days. So, if you see the initial doubling rate, Italy, Spain, and Iran had a doubling rate of 2 to 3 days. So, every second day, the number of cases doubled. So, they ended up this way. They ended up very high. India performed much better with a doubling rate of about 1 week. Now, our doubling rate has crossed 10. It is fluctuating between a week and 10 days. That's why we are lagging low and in a comfortable position as of now compared to the other countries which face this pandemic. The important thing is, after the initial burst, China, South Korea, and Japan have managed to flatten the curve, as you see. What is required for us to do is we need to flatten the curve this way, China, South Korea, and Japan. But if you see the Indian curve, we are still peaking. We are still growing up. We have to flatten the curve here, and that will give us the maximum achievement in controlling the pandemic. If you see this curve here, this graph was tabulated up to April 24th. If you see on this y-axis, the new cases are shown, and on the x-axis are the days, and on this y-axis, cumulative number of cases. So when this graph was tabulated on 24th April, they expected that if we flatten the curve at this point, we would have been here. But what is happening? We are still peaking. So as on yesterday, as on 7th May, we had a new case detection of 3,600, and that has resulted in cumulative number of active cases around 40,000 that day, but the current figures have crossed 42,000. What does this mean? That we are still peaking and we do need to flatten our curve. If you see this graph here, the number of active cases from the first day till now, if we had flattened the curve, we should have gone this way. But as on May 9th, we have crossed 40,000 and today we are 42,000. So we are still growing. We need to flatten the curve this way and come down. So once we flatten the curve, what happens? Here's a very appropriate analogy. The curve is flattening. Can we start lifting the restrictions now? Once the curve flattens, can we remove the restrictions immediately? That tantamounts to the parachute having been slowed down and that our rate of descent has slowed down. Can we afford to take it off now? You will fall down with a thud. Similarly, the fire has reached its peak. Is it no longer growing? The acceleration curve has flattened. So everybody back into the building. Is it all safe to return to the building? The answer is no. So the lessons from history, the most severe pandemic in history was the Spanish flu, as Dr. Anil said, in 1918. It lasted for 2 years in 3 waves, mind you, 3 waves, with 500 million people getting infected and 50 million deaths. Most of the fatalities happened in the second wave. The people felt so bad about the quarantine and social distancing, as some of us are now feeling, and measures that when they were first lifted, the people rejoiced in the streets with abandon. In the coming weeks, the second wave occurred with tens of millions dead. We ended up losing 50 million of the population. So if you see here, this is the first wave. At this point, the lockdown was lifted. People rejoiced in abandon, and that led to the second wave, which was much more severe, ending up in tens of millions of deaths. Then again, there was a remittance. After some time, there was a third wave. So mind you, this pandemic in 1918 lasted for 2 years. So Corona, don't think that it is going to go away soon. Let us not repeat the history in the time of COVID-19 too. So Anil has beautifully enumerated about the signs and symptoms. I'm only going to enumerate and reiterate them here. The common symptoms that should alert you is fever, tiredness, and dry cough. Some people may experience aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. On an average 5 to 6 days from when someone is infected with the virus for the symptoms to show. However, it can take up to 14 days, and this is called the incubation period. From the date of infection up to the signs and symptoms, the day when you observe the signs and symptoms, that is the incubation period, which has been beautifully enumerated earlier by Dr. Anil. People with mild symptoms who are otherwise healthy should self-isolate, seek medical attention if you have fever, cough, and difficulty in breathing, and call ahead. Also, the case definitions, Anil beautifully enumerated about the suspects. Who are suspects? If a person is acute respiratory illness and a history of travel. History of travel in the current sense, as reiterated by Anil, is not travel to international or not interstate travel. It is as good as travel or a visit to a common crowded area. The second category is any respiratory acute illness coupled with a contact with a confirmed COVID-19 case. If you are a contact with a confirmed COVID-19 case and if you are having acute respiratory illness, you are a suspect. And thirdly, a severe acute respiratory infection that requires hospitalization, again you are a suspect, and a case in whom the testing is inconclusive. The lab confirmed case is when the confirmation has come from the lab. A contact is again, as enumerated by Anil, high risk and low risk. If you have touched the body fluids of the patient, had a direct physical contact with the body, touched or cleaned the linens, clothes, dishes of the patient, live in the same household environment, and if you are within 3 feet distance of the patient, and for over 15 minutes with the patient, you are in a high risk. But when you are sharing the same space, like school, worked in the same room, or similar, not in having a high risk exposure to the confirmed or a suspect case, or traveled in some environment, like if you have traveled in the same compartment as from the compartment a case was detected, you are a low risk suspect. So once you are a suspect, a quarantine is advised. And what does the government of India, the Ministry of Health and Family Welfare advise you? The precautionary steps are you have to stay in a well-ventilated single room for 14 days. Single room is important. You stay alone for 2 weeks. Wash your hands frequently with soap and water or use alcohol-based hand sanitizer. Always wear a face mask. Maintain proper hygiene. Maintain social distance from family members, especially the elderly and children. Less than 10 years, more than 70 years, absolutely you have to keep away from them, and do not share the same household items like clothes, food, or utensils. Now, post-lockdown, once the lockdown is lifted, remember the fundamental law of protection is consider everybody around you as an asymptomatic carrier of COVID-19 and capable of infecting you. Consider too that you yourself could be an asymptomatic carrier of COVID-19 capable of infecting all around you. So train yourself by using all your intelligence to neither get infected nor infect others. And what is advisable? Each one should mandatorily download this official app. And this app, Arogya Setu, helps in tracking if there is any positive case within your reach or vicinity. And this helps you epidemiologically trying to stay safe and to stay healthy. So, with these slides, what is shown is the probability of contagion. If you are not using a mask, if the patient is not using a mask, if the patient coughs or sneezes, the probability of contagion infecting you is very high, almost 100%. But here, if you see, if you are wearing the mask, if the patient is not wearing the mask, as you see analogy here, the transmission is probably 70%. If the patient is wearing the mask and you are not wearing the mask, the probability drops down drastically to 5%. And if both the patient and you are taking your precaution, patient is taking a precaution by wearing a mask, the probability is as low as 1.5%. What does it mean? The probability drops down from a very high, near 10% probability to just 1.5% by using masks regularly by both suspects, patients, as well as healthy individuals. So, what are the types of masks available? The fashion nowadays is to go for a mask which is more costly. And the more costly masks are the so-called N95 masks or N99.7 masks are also available in the market. The N95 respirator is so because it filters out at least 95% of the small particles. N95 are high-grade protective gear that should be only worn by the medical workers interacting with infected people on a daily basis. People who are exposed to high viral load, they should only wear these kind of masks. If the general population wears this mask and travels out in the heat and humidity, prolonged use of these masks can produce hypoxia, that is lack of oxygen in your body, and breathing over and over the exhaled air, and air turns into carbon dioxide. After some time, you may feel dizzy. That's why please don't wear these kind of masks for the general population. Let us reserve these masks for doctors and healthcare workers who use these and who are in dire need of these masks. And one more important thing I would like to highlight is that doctors and the healthcare workers are not 100% safe with these kind of masks because these have a filtering capacity of 0.3 microns, but the virus COVID-19 is just zero point 0.1 micron size. So a high viral load, a doctor wearing an N95 mask can also get infected because a zero point 0.1 micron virus can pass through the zero point 0.3 microns pore in the N95 mask. The next is surgical mask, that is a so typical 3-ply mask or the 2-ply mask that are available in the market. Suggestion for the general public is even let these resources be used by the healthcare workers because we have the money is in your hand, but the resources belong to the nation. If the general public starts using these kind of masks, they will be in short supply and the healthcare workers will find it difficult to use them. And if at all you are using these kind of masks, the right to use this mask is the counter the plate should be facing downwards so that if there are any particular deposits on these masks, if you use it this way, when the pleats are facing up, the particles deposit on these areas and then you are likely to be infected. So the right way of using a surgical mask is pleat down. But for the general public, and how much is the filtering capacity of these masks? It is 5 microns. So this is also offers a reasonable amount of protection, and these again should be reserved for the healthcare workers. Whereas for the general public, the difference is just 10 microns. By using the regular cloth mask, a double layered cloth mask is sufficient for the general population to exercise reasonable control. And this is going to be the norm in the future. You might get shirts along with the matching mask, which is not at all a the impossibility in the near future. We have to get used to this kind of a situation. The second most important thing is the social distancing. The social distancing, what do we aim to achieve? We aim to achieve this infectivity curve below the healthcare system capacity so that the healthcare system that we are having is easily able to manage the infected cases and we are able to sustain our healthcare system. What is the social distancing? It should be actually said you must maintain a 2-meter distance between a confirmed infected case and yourself. But if unknown people are there, the general guideline to the general population is you must maintain at least a 1-meter distance. And now I would like to introduce you to two definitions: suppression and mitigation. In any pandemic, there are three phases. One is the initial infection. The second phase is we try to suppress the infection in this community. And this suppression means that the average number of secondary cases that each case generates, if one positive person is there, that person is spreading infection to 10 people. That means the rate of infectivity is very high. So we need to suppress the rate of infectivity such that the value R should be less than 1. That means one infected person should not be in a position to spread the disease to more than one person. Once you try to restrict this value R to less than 1, then our infectivity rates begin to fall, come down into the reasonable vicinity. And what is mitigation? Once we suppress the pandemic, the third phase, that is to reduce the human to human transmission substantially by building herd immunity. We have to achieve this herd immunity over a period of time. While the 50 to 60% of the population will get subclinically infected by this virus, and that leads to herd immunity. The population as a whole will get immune to this disease, either this way or from the point that the vaccine is invented. Once we carry out the mass vaccination process, we can be able to achieve the herd immunity, that is the phase 3 of the pandemic. Anil has again beautifully reiterated how to maintain your personal hygiene and personal protection. All the 7 steps he has highlighted. Important thing to know is, even if good soap we can give good lather, that is enough to kill the organisms. Ideally, it is said that you must scrub your hands with all these 7 steps for 40 seconds, if not 40 seconds, at least for a minimum of 20 seconds. And mind you, the difference between disinfection with soap or a liquid soap or alcoholic hand sanitizers is the method is the same. With a hand sanitizer, you have to scrub your hands for at least 20 seconds till the the disinfectant evaporates on its own. You don't wipe out your hands. And one precaution that you need to take, if your hands are dirty, don't just be happy in using a disinfectant, alcohol-based disinfectant. You need to first wash your hands. Disinfected alcohol-based disinfectants should be used only on clean hands. Of hand sanitizers available in the market, and they say that some say 50%, 60%. The percentage of alcohol content that is required is a minimum of 70%, ideally 75%. So your disinfectant should have an alcohol content of at least 70%. Only that alcohol, that content, disinfectant is advisable to disinfect your hands against COVID-19. Some people may really say, you get many messages in the WhatsApp factory, I drink 2 pegs of whiskey. Yeah, they say it is alcohol and I'm protected. Mind you, best available strongest whiskey is only 47%, and when you dilute with so that just not sufficient to disinfect you from this. So what is required is any disinfectant that has 70 message. Coming to the next, what is COVID, how it's transmitted. Then I have told you about how our country is facing this pandemic and what would have happened if we had not taken these measures, and why we are continuing the lockdown still, because we have not reached the peak. And now it is going to impact on our economy as well as impact the academic schedule and academic calendar. So as you all academicians are going to be affected by this, so the university guidelines, UGC has constituted 2 committees to study this thing and issue recommendations to the universities, and the UGC experts panel has basically given suggestions to the UGC, and these suggestions are given to the universities. Number 1, tentatively, they want to start 2021 in October. They want to start the academic session 21 August, September. What they say is from 1st August, you have 4 years students, and from August 1st, you can begin your admissions, and the first year classes can begin tentatively from 1st September. We need to wait and watch. If we have flattened the curve, and again, if we are on the downslide, this is possible. We have to further wait for the government guidelines, and you have to take into consideration the UGC guidelines given to the universities and how best you can try to use those guidelines to the practically best of your ability and knowledge. The colleges should develop a foolproof plan for disinfection. You have to pay a lot of attention to this. Devise a pro forma to record the travel, stay history of all students and faculty members also. Everybody in the institution, you have to devise a pro forma to record this history and record their medical history. Follow social distancing norms. Make lab work virtual, because in the computer labs, they are closed areas, air conditioners, there is no, the same air circulates within the atmosphere, the students are close by, the laptops are close by. So what the guidelines say is you have to make the lab work absolutely virtual, and you can conduct the lab work practicals online. Virtual online classes, 25 to 40% of the syllabus is recommended to be done online. One committee suggested at least 25%. That committee was led by the Vice Chancellor of Haryana University, and the second committee led by Dr. D. Nageshwar Rao from AP. They suggested that about 40% of the syllabus has to be completed online. Online training for the entire staff is mandatory. This is a do and die situation for all you academicians. Universities, though, have the freedom to decide the exam plan. And last but not the least, there may be no winter break for you all. Be prepared for that eventuality. So let us now discuss a bit in detail, and I would like to take you to the theme that we as clinicians in hospitals, what we are doing, and you as academicians in your colleges can possibly ideally do, but it all depends on the infrastructure and the facilities available in your respective colleges and with the respective universities guidelines, that you have to do your best practically howsoever possible. So in hospitals, we have something called a triage team. What the triage team does is, it is constituted by a team of doctor, paramedical staff, and a trained counselor. And we take the general decisions and screen for emergency and ask the following questions: any travel history or a family member having respiratory illness, and then such patients we treat at the triage area itself and give treatment and send them away. We don't let that patient enter into our premises. Like what the colleges can do when the lockdown is done away with, you can also form something called as a triage team. And what this triage team can comprise of? It can comprise of a security or class 4 staff that can check temperature with infrared thermometer. This is most vital. Don't permit any student or any faculty member with temperature more than 99 into your premises. And that can be done. Every college should purchase this thermometer, infrared thermometer, which is available in the market around 6,000 to 7,000 rupees. Good thermometer. This photograph is from a college in UP, from a district. A security staff is screening every student with a digital thermometer and then letting the student in. Provision of hand sanitizers at the point of biometric attendance. Biometric attendance has been made compulsory by the universities in most of the colleges, and before biometric, because biometrics touch screen is acting as an active fomite that can result in spread of infection. So you have to provide kiosks like this, where the students need to disinfect with an alcohol desanitizer and then do the and unless you have this kind of a triage entry, if any person has a temperature more than 9, or if the person has a temperature more than 99, any history of family history of fever, cough, and respiratory illness, don't in the university. Generally, they have a cutoff of 75% attendance. Please, this year, I would like to request all the to reconsider with the students and reduce the percentage of attendance to about 50%. That Christian suggestion to all the universities. However, best the university own decisions. The next is the use of disinfectants like Lysol or cleaning of all surfaces likely to be in contact with the student contact, such as doorknobs. You should train your class 4 staff every 4 hours. These fomite areas, their staff should have gloves and doorknobs, telephone handles, or any such things like where the likelihood of the students touching or the faculty touching, they should be mopped. And the mopping of the floors at least twice or thrice a day should be made mandatory. Spraying of sodium hypochlorite, that is the bleach, in the concentration of 0.5% or 1% on the walls and in large areas is the recommended way of disinfecting large walls and large areas. Now, devise a pro forma to record travel, stay history of all students and faculty members. What we have done is, from our professional ophthalmological societies, we have devised a Corona Pandemic Emergency Ophthalmic Treatment Consent Form, which explicitly states and absolves the hospital of the responsibility of transmission of COVID. Like in hospitals, at the reception desk, a consent form eliciting the history and disclaimer about the hospital responsibility. Unless the patient signs this COVID consent form, the patient is not let into our hospitals. A similar thing can be done in colleges. You have to devise a pro forma from the fall colleges. A consent form needs to be taken from all the stakeholders, students, staff, administrator, including the principal and the management, that the college will not be held responsible for any eventuality. Unless this is done, the colleges can be sued by the students or vice versa. The students can be sued by their colleagues or other batchmates for spreading the infection. So avoid this disclaimer consent form is mandatory. Social distancing norms. If you are having a lift facility in your colleges, then this is the way. The foot mark should be marked, and the people standing in the lift should not face each other. In one lift, 3 persons should be accommodated in 10 square feet area. If your lift is having an area of 10 square feet, that should, per person 3 square feet area is mandatory. More than that, the lift should not be overcrowded. And in classrooms, all doors and windows should remain open. There should be a good cross ventilation. AC, if it is available, can be run maintaining temperature between 26 and 28 degrees. And then the students need to maintain at least 1 meter distance. Like if you see this picture, these are the two face each other, and 3 persons in 10 square feet area is the requirement, and all doors and windows should be remain open, and there should be a good cross ventilation in your classrooms. AC can be run for maintaining temperature between 26 and 28 degrees, and students need to maintain a 1 meter distance. What we use in the hospitals is something, an acrylic barrier that acts as a respiratory barrier for us, and we use gloves, masks, and goggles. A similar out-of-the-box thinking by putting these plastic barriers in front of the students. With this, you need not separate the students out much, and you can adopt your own strategy. The next thing is, you can use your large seating areas in your colleges, in like seminar halls, auditoria, etc., and they can be utilized for taking classes by observing social distancing norms. And in case the infrastructure is inadequate to follow these norms of social distancing, staggered timings of classes can be considered. What do you mean by staggered timings? This is just a suggestion. Again, it is up to the universities and the colleges to adopt. Since the government is suggesting that, since the universities are suggesting that 40% of the classes can go online, what does it mean? That if you are having 30 working hours in a week, you can reduce those number of working hours to 18 hours a week. And what you can achieve by doing this, you can it asks this semester or the year, first year and the second year to come for the first 3 hours, first years and the third years can continue, come for the next 3 hours. Like you can adopt this 1 2 2 3 3 1 approach and adjust your number of working hours and cover the remaining 40% of your portions online. It is all up to you. You have to think out of the box and you have to devise your own strategy. What we do in the social distancing norms in the lobbies and in the canteens, in the meeting lounges, with spacing apart, rapid turnaround time. Suppose if a person has come for some purpose in the college, the person should be attended to early. I'm using the word you can sit this way. You are seated this way. Now, make lab work virtual. Virtual online classes for at least 25 to 40% of the syllabus is recommended, and online training for the entire staff is mandatory. Again, to reiterate, college managements can consider reducing the teaching hours by 40% to adjust for the social distancing norms. Here, I would again like to reiterate, some academicians may think that it is too late for me to be computer savvy. No, it is not acceptable because the UGC has made online training for entire staff mandatory. If you are not accustomed to computer work, get trained right away. And by the time your college or institution opens, you should be ready for this. What I would like to say, it is a perform or perish situation for you academicians. What it means, I can again say analogy between clinicians and academicians is that like oxygen is important to us in our treatment protocol, Wi-Fi should be mandatory and useful to you academicians to achieve this ideology of 40% syllabus to be completed online. Now, universities have freedom to decide about the exam plan, but there need not be any winter break. So depending on the infrastructure, alternative and simplified modes of examinations may be adopted to complete the process in short time. What you can consider, you can go for online exams, an open book exam, or a MCQ type of an examination to finish off your semesters early. Open choice examination, you can evaluate the assignments of your students and be done away with the semester, or a presentation based assessment. It is all open for the universities. With their guidelines, the colleges can adopt that policies. Now, regimen from clinicians to academicians. What a doctor from me and Anil, what we have to say to you, all academicians, faculty, esteemed delegates, is the lockdown or no lockdown. Next 6 to 12 months, take precautions. As we said in the earlier slide, then the earlier pandemic, Spanish flu in 1918, lasted for 2 years. So it is not going to go away soon. The threat of corona is not going to end soon. We are going to be in this situation till we find and develop a vaccine for the disease. Unless we start mass immunization of the population, we are not going to overcome this malady. Avoid international travel for now for at least 1 to 2 years and restrict domestic travel. Use online platforms for guest lectures and talks. Avoid unnecessary meetings. Always keep in mind social distancing. Keep the face mask on when you are in public places. Do not go to crowded places for at least 1 year. Do not go to cinema hall, crowded market now. If possible, park, party, etc. should be avoided. Even if you get invited to so many social functions, attend it only if mandatory. Otherwise, as much as possible, try to avoid or restrict functions like marriage or similar functions, and be very careful at the barber shop or beauty salon parlor. Avoid. Instead of 3 months or 2 months, try to go to the barber shop or let the barbers come to your house. Use your own towels, use your own cover to cover, and the barber should use only sterile disinfectant dip, razor, lasers and instruments on you. There is a mass scope, like just yesterday I read in the news that one person in the LB Nagar area spread infection to 45 by inviting them to a birthday party. And there are instances like from the salons and spas and barber the salons, there is a possibility of spread of infection by using the same drape cloth that was used. They just dry wipe the cloth and again put on the next person. The drape was used for 12 patients, and 6 persons of those, that particular positive patient became positive subsequently. So these things have to be kept in mind in the near future. Increase immunity. That means you need to consume foods rich in vitamin C, antioxidants, nutrient, and alkaline foods. Alkaline foods in the sense you need to take a lot of substances they were important in vitamin C and natural nutrients and antioxidant capsules, or even herbal medicines like Chawanprash that is commercially available in the market, that are known to increase the immunity for you. The treatment aspects and all about the other systems of medicine, as of now, everything is on a trial basis. We can't vouch for it. Stay away from a person who has cough. And if you cough, cover your mouth with a tissue and discard it immediately, or cover your mouth with your bent elbow this way and cough. Don't cough into the open area. As Anil demonstrated, you are likely to spread 10,000 droplets in the environment near you. And as much as possible, avoid handkerchief in the near future. Carry a sanitizer. A small 100 ml sanitizer can be carried in your purses or in your pouch, and use tissue if required. Avoid fomites like belt, rings, wristwatch when you go out. Stop using the watch now. Watch is not a fashion. Your mobile has got time. Time is important, not the brand of watch that you are wearing for the next 1 year, please. Don't bring the shoes into your house. Our good old systems that we used to follow, leave them outside. Now everything is materialistic. We just rush into our house, deposit our shoes in our bedroom. Clean your hands and legs when you come home from outside. Nothing new. We used to adopt this as a child. I was made to do this, but are we doing this now? That is for us to introspect. When you feel that you have come nearer to a suspected patient, take a thorough bath. This is for the future. Like now, when you have the curve is coming down, if you have a least suspicion, probably you have contact, come home, the first thing that you can do is take a thorough bath. And always remember, no nourishment like joy. Be happy. And disease is worse than worry. The very worry can make you sick. Try to be happy. Try to have the joy is the best possible. But I would certainly like to say mouth, eyes, and nose. Avoid mouth, eyes, nose. Instead, follow, wash your hands, obey social distancing, mask up, exercise, and eat well. No unnecessary traveling. These are the takeaway messages. Why I am takeaway for these online meetings. Suppose if I was to be not seen, if it is only an audio meeting, you can afford to be like this, like all you attendees. Probably even if you are like this, we are not able to see, you are enjoying our webinar. But as a speaker, I am with my glasses, I am suited, booted, like whatever it may be. I may not be in a trouser below, I may be in my shorts, but to you, I am with the video, I am doing this online meeting. And one rare positive thing about webinars is that it doesn't have any take-home messages since you are already at home. So now, always remember, it is our attitude at the beginning of a difficult task which more than anything else will affect its successful outcome. As quoted by William James, Home is where the health is. Stay happy, stay safe, be patient. We shall all overcome. Thank you all for your patient hearings. And before I conclude, I would like to extend my sincere thanks to Villa Murray Degree College for Women, Hyderabad, its management led by the founder, principal, and correspondent, Dr. Philomena, in charge, Mrs. Revati Devi Mathur, and the brilliant IQAC team led by Mrs. Atya and ably assisted by Mr. Chandrasekhar, Mr. Naveen, and they on the whole ably assisted by Ms. Saida, who is the technical in charge for the IQAC team. The entire international and national audience, I was thrilled yesterday when I came to know that pre-registrations we have received from 10 Indian states and 2 national countries, Maldives and Dubai. So thank you all again for your patient hearing. With this, I conclude my talk in the hope that both Anil and myself, we have been able to communicate in the best way possible about the disease, what precautions we need to take, and after lockdown, what the UGC has suggested on a similar platform, what we clinicians are doing and what we expect the academicians or the faculty of the degree colleges and the managements to adopt. Thank you all. Thank you very much. We would now like to welcome questions. Mrs. Satya. Mrs. Satya, are you there? Probably you can open
Yes, sir.
your Anil, you can open your video. Yeah, Anil, you can open your video and then we will take the questions from the chat box. Anybody, you can type in the chat box.
Thank you, Doctor. That was indeed valuable to us now, characterized by clear perception. Thank you for that enriching session and valuable inputs. We'll definitely bear in mind all the measures prompted by both of you today. You were the right people at the right time. Let us resolve that besides the frontline warriors, we, the unseen warriors, will curb the threat of this pandemic by intellectual development. Our medical experts speak more on COVID-19, busting the myths and providing reliable, up-to-date information by answering a few questions lined up for them. We have few questions here, Doctor. The first question is for
Yeah.
Dr. Anil. Can viral genome affect human genome and ultimate upcoming generations?
No, it's a very short-lived phase. The virus which infects an individual, so when the disease will be present, once the disease is over, there is no virus in the blood, and there are protective antibodies have developed. But there is a possibility that the pregnant woman who's in term, the virus, and if it is a natural delivery, there is a possibility that the virus can be transmitted to newborn.
Thank you, sir. There's one more question for Dr. Manoj Mathur. How to disinfect big places
Yeah.
like colleges?
How to say? Like as I enumerated in my talk, the large spaces can be disinfected by use of bleaching powder, that is sodium hypochlorite solution. It is commercially easily available in the market. You have to dilute it for 0.5% or 1%, 0.5% in large areas like grounds and walls of the compound walls, and 1% hypochlorite solution in inner classrooms and closed areas. And for personal disinfection, alcohol sanitizers which have an alcohol content of 70 to 75% can be used. As I told you in my presentation, just before the biometric attendance or just before the students enter the college premises, if their hand should be disinfected, and then the biometric attendance taken, and then only then the student should be let into the classrooms. Same for the faculty.
Thank you, doctor. There's one more question. What medicines should be stocked in the college during the epidemic in case of emergency?
Medicines in the sense to be stopped, like there is no harm. Like if you are suspecting a viral etiology, you can take just paracetamol. Don't take aspirins and other. This thing, paracetamol is safe to control your temperature, but you get yourself evaluated by a doctor. What medicines to stop for the regular comorbidities? You need not stop the medicines. The medication for the regular comorbidities can continue. Like if you
Thank
are
you,
a
doctor.
diabetic or if you are a thyroid disorder, those medicines need not be discontinued. Those medicines should be taken. The only treatment, as Anil has said, is some antiviral and anti-HIV treatment that is done only under medical supervision in the hospitals. As far as the general community is concerned, you need not stop taking any regular medication that you are taking. But for these symptoms of COVID, take only paracetamol from your side and approach a clinician.
Okay. There's one question for Dr. Anil. Are there any imaging techniques to find out a COVID-19 patient?
Yeah, could you just CT picture. See, nowadays all hospitals do not have a facility for testing these big and expensive tests like RT-PCR. The patient needs a so, and what is observed is that uh, if there are any opacities are present, so a radiologist will be able to tell whether there are any changes in the lungs suggestive of pneumonia, viral pneumonia. And they are very peculiar in this situation. Their ground glass opacities are seen, which are not missed. So CT is a good alternative for performing RT-PCR.
And I would like to add one more point here. The type of opacity seen in COVID-19 are generally seen in the periphery of the lungs, unlike consolidation and one big mass that you see in the normal pneumonia cases. There are some distinct clinical features that the radiologist and the clinicians will decide. If you are not having this rapid test or radiologically by CT scan, as Anil said, the clinicians can come to a reasonable conclusion whether they are dealing with a COVID case or not. I would request all the attendees to mute their mics because when we are speaking, if anybody else mic is on, there is a lot of audio disturbance.
Thank you, doctor. No. One question from the dentist. What should be my instructions to my patients towards their non-emergency treatments and procedures?
Immediately don't attend to those patients. Like we ophthalmologists and dental, we are almost similar. We go close to the patients. Why most of the eye hospitals are closed? It is only because it is not worth it. You are getting infected and you may spread the infection to your family. On the contrary, one infected patient can spread infection to the other patient. Because we go very close to the patient, we have to adopt PPEs requisite to the requirement, and that we don't want to contribute to the spread. Similarly, the dentists, they go into the mouth cavity, which is a highly infected area. all elective procedures have to be shelved for now. Only emergencies without touch, only infections and all, they can be treated with antibiotics or under required PPE procedures. They only need to be attended. Otherwise, the scope of infection spreading into to the doctor, through the doctor to the family, and through the doctor to the community is very, very high.
Yes.
Thank you, doctors. One last question coming your way. The attendee asks that heard that virus has become structurally more stronger than before. Is it true? If so, what are the precautions to be taken?
Uh, Actually, I'll put it this way: it has not become strong. The virus undergoes mutation, and what is happening is the in this pandemic, if you see in some countries the mortality rate is high, or in India, if we see there are few places where the mortality is high, but in other countries it is not like that. So what is happening is there are three strains of this SARS-CoV-2 are circulating. So there are few strains which are in Mumbai. There is a high mortality, whereas in US there is a high mortality, New York. So which strains are circulating in any particular epidemiological situation, we need further studies, and that will be known only when their genetic structure has been known, and the outcome of these patients can be correlated based on that. And mutations is a very common property in coronaviruses, so that is why the chances of developing effective vaccine is a big challenge.
Okay, thank you, doctor. We have few more questions. We are actually flooded with questions here. Are there any chances for corona to spread from animals in future?
Yes, if you see 2002, there was SARS, 2012 it was MERS, 2019 it is SARS-CoV-2. So we don't know 2022 what we will have unless we change our habits, our eating habits, our methods of transportation or medicines, and the international travel. And there should be a lot of restrictions for this animal sale across boundaries. That international, see, if in one country some kinds of animals are a delicacy, so these kind of animals are transported from all other countries. So lot of international regulations, national regulations have to come into practice. And the forest industry, that forest department, they also play an important role in this. It is not just the medical department or the society as such, and it needs a higher approach, holistic approach by multidisciplinary departments.
What
Yes,
it means
definitely, doctor.
is the better way is to be a vegetarian diet, have a vegetarian diet in the near future, but non-veg diet is not contraindicated. If you are habituated, you can certainly consume non-veg diet, but cook it well. Don't use improperly cooked non-vegetarian stuff. Cook it well and you can consume. That should be the takeaway message as of now.
Yes, doctor, definitely. We have one more question here. What is plasma therapy and to what extent and how is it helping during COVID-19? Also, the same attendee has one more question lined up. Myth of hot water, garglings, different hot liquids as a cure for COVID-19.
I'll answer this. Regarding the plasma therapy. Plasma therapy is like the person who has suffered from a viral infection and he has recovered. So this particular individual has got protective antibodies. So now if we take this patient's blood, separate the serum, or the plasma and then transfer it to some patient who's, who's in a crisis now. So what has happened is, this is a proposed theory as such, but practically what is observed is it worked in some situations, and in some situations there were deaths were observed. So till now, authentically, we cannot say that plasma therapy will definitely help. It has its own drawbacks.
Yes, doctor. One more attendee asked that please suggest
You can
certain
take up the
exercises.
second
Are
part
there
of the
good?
question.
Yes,
Walking.
yeah. Exercises is good. See, we have to overall improve our immunity. One is we should have a sound sleep of 6 to 8 hours, depending on the age group. So young individuals like teenagers who are in the college, they may need 8 hours sleep. So somehow they have to see that they sleep during the night time. Morning they do exercise, eat healthy food, and take a regular, like vitamin D is a big deficiency in our country. So they must take some supplements for vitamin D and vitamin E also, and daily consumption of vitamin C. So all this and a good protein, calorie rich diet, so that will make the person immunity strong.
And the question regarding the gargling of hot fluids and all, like it is presumed, it is not conclusively proved that the virus enters through the respiratory system as an initial stopgap arrangement. The virus gets lodged in your pharynx. So the theory says that if you gargle your mouth 2 to 3 times a day, probably with a natural disinfectant like turmeric in it and salt water, you can wash out the reservoir of virus from the throat. That may hold good to certain extent. You may be able to do away with the virus to certain extent, but the infectivity factor remains. Gargling is not a foolproof method to avoid infection. It can certainly reduce the intensity of infection by reducing the viral load.
Okay. Sir, last question for both the doctors. What is the Mother's Day message you wish to convey to all the women out here?
Mother is a strong pillar of the house. She has to be strong, and the family should take care and see that the mother is healthy so that the family is healthy. I wish all the mothers a very healthy day, and because the mother can inculcate all healthy habits into children, and that is into the society also. Thank you.
Thank you very much.
Manoj, sir, we are not able to hear you. If you could please check your.
I'll repeat again because I muted. So what I was trying to say is mother is the prime minister of the family with an additional charge of finance, and father is only a finance minister and to the best possible extent probably an external affairs minister who is responsible in maintaining relations in the society to certain extent more than the mother. But mother and father are the two pillars of the family, and mother is more prominent among the two. So we wish a very happy Mother's Day. Mother's Day is only a Western culture. For us in India, every day should be a Mother's Day. You don't need to a day to celebrate or ever express your reverence to your mother. Every day should be a Mother's Day. But since one day is devoted to all the mothers, I would like to wish them happy Mother's Day.
Thank you, doctors. Thank you so much. I hope we answered all your queries, dear participants. Moving on behalf of the IQAC team of Villamari Degree College, I wish to convey my heartfelt thanks to Dr. Philomena ma'am for her constant encouragement and guiding us throughout. I wish to thank Mrs. Revati Devi Mathur, in charge, Villamari Degree College, for her untiring support and overwhelming motivation. I wish to extend amiable thanks to our resource persons, Dr. Manoj Chandra Mathur and Dr. Anil Bilolikar. Thank you, doctors, for investing your precious time and giving us the much information needed today. I would like to thank all the attendees for their patient listening and overwhelming participation. Thank you, audience. In the end, I would like to congratulate and thank the forerunners, the IQAC team, without whom this webinar wouldn't have been possible. Thank you for all your constant support and logistics. Your opinion matters to us, so that we improvise. I request Mr. Chandrasekhar sir to share the link for the submission of the feedback forms on the screen. The link will be forwarded to you in your mail as well. Dear attendees, please follow the link to submit your feedback forms and be assured that the certificates will be generated once you submit your feedback form. Please give us time. Your certificates will be emailed to you within a week's time. For further queries, reach us at iqacvmdc@gmail.com. The information is available on the screen as well. Until then, keep calm, stay safe. Have a good day, everyone.
Thank you. Thank you. Huh? Bye, sir.
ये तो भी अच्छा है फीडबैक
Madam, hello. Kindly send the feedback form to my mail.
Thank you so much for your wonderful information to us. Thank you so much.
Hello.
Hello.
I request. Hello. I request you. I didn't get feedback form. Kindly send to. Hello. Hello. I request you please send feedback form link.
Dear participants, you will be getting the
Yes.
feedback on your mails.
I couldn't get feedback form link. Please kindly send to me. Yes, please.
Please
On your
send
mails,
us
kindly
mail.
send.
Thank you so much for wonderful information.
It was very informative and exhaustive session. Thank you so much, panel, and congratulations to Villamari College for such a wonderful session.
The talk of both the doctors has been wonderful and it is very informative. Thank you very much, sir. I'm Dr. Anupama here. Thank you.
Ma'am, the link is not getting open.